Hello, everyone, and thank you for tuning in to my health and wellness channel. I'm Dr. Gauri Bhede, and I'm a medical oncologist. I've been doing a series on vitamins and minerals that patients commonly take, and do refer back to my earlier videos for additional information. Today, I am continuing on to an important but under recognized element called zinc. Nutritional minerals are those that we need to consume because they are important for many important physiological and metabolic functions. Some we need in macro quantities like sodium, potassium, calcium, magnesium. Others we need in trace amounts of less than 100 milligrams daily, like iodine, fluoride, and zinc. And some we need in ultra trace quantities like selenium and chromium. We don't usually think of the trace and ultra trace elements too much because we usually get plenty of these in a well balanced diet. They are well absorbed through the gut and distributed through circulation. Unless you have a poor diet because of chronic gastrointestinal issues or gastric surgery, or you are in an impoverished area and have poor access, you are getting enough of these minerals through nuts, grains, fruits and vegetables, meats, fish, and poultry. And in the developed world, our flours and cereals are additionally fortified to provide plenty of the recommended daily allowance. Besides going through the list of supplements that my patients commonly take, I have also been going through my own medicine cabinet. And here's the one that we are going to talk about today: zinc. Why do I have zinc in my medicine cabinet? I have it for decreasing the severity and duration of the common cold. When I get a cold, I will commonly take a vitamin C, a hot lemon and honey drink, a decongestant if I need it, and a zinc tablet for a few days. There are zinc lozenges for people who prefer those, but the FDA strongly recommends against using nasal sprays which contain zinc because they can permanently damage your sense of smell. When you use zinc as an industrial metal, it is alloyed with lead and tin to make solder, which is a metal that is used to join electrical components, pipes, and other metallic items. Other zinc alloys include nickel silver, German silver, and typewriter metal. But zinc as a nutritional mineral is a vital part of a group of proteins involved in gene transcription called zinc finger proteins. Gene transcription decodes the message that the gene carries into functional proteins. At least 250 proteins contain zinc, including enzymes that are important for tissue repair, wound healing, lipid, and glucose metabolism. Zinc is also necessary to maintain a healthy immune system. We know that zinc deficiency is associated with impaired phagocyte function, which means that we cannot eat up all the unwanted invaders like bacteria. It also reduces lymphocytes and reduces the T4 to T8 lymphocyte ratio, and this will impair viral defense. It decreases immunoglobulin production and decreases interleukin production, and all of this is important for a healthy immune system. In the brain, zinc is necessary for 100 different metal enzyme complexes. It is an important cofactor for metabolism relevant to neurotransmitters, prostaglandins, and melatonin, and indirectly affects dopamine metabolism. Specific to attention deficit hyperactivity disorder or ADHD, the dopamine transporter has a zinc binding site that blocks transport. Both animal and human findings suggest involvement of zinc deficiency in ADHD. So, does it help to take zinc for ADHD? As noted in this study, if children with ADHD have a zinc deficiency and are not responding well to their ADHD medication, supplemental zinc may help as an add on treatment to decrease the symptoms of hyperactivity. It does not work by itself, but it can decrease the dosage of the prescription medicine that is required. Do note that some of these studies were performed in regions of the world that zinc deficiency is common, and so it showed the benefit in decreasing their symptoms. And also note it did not improve attention span. The same is true in treatment of major depression as seen in this study. This study was a double blind, randomized clinical trial. 44 patients with major depression were randomly assigned to groups receiving either zinc supplementation of 25 milligrams or placebo, along with their SSRI antidepressant. After 12 weeks, they found that taking zinc along with their antidepressant was better than placebo in the treatment of major depression in patients who are not responding to the prescription medicines alone. Antidepressants may be having their effect through zinc-containing neurons, and zinc may be helping through its effect on the neurotransmitters. Where else can zinc help? Elderly patients who are confined to bed are prone to getting bed sores at pressure points. To begin with, they have fragile skin, and then you add on to that, they likely have nutrition deficiency, which makes them deficient in vital minerals. Zinc paste applied topically to the bed sore helps in healing them. The same applies to leg sores from poor circulation, called venous leg ulcers, diaper rashes, and foot sores in people with diabetes. Zinc is also beneficial in the treatment of acne if used in combination with an antibiotic. By itself, it is unclear whether oral zinc is beneficial. Taking zinc can help improve blood sugar control in type 2 diabetes as well as pregnancy-related diabetes. It improves the way the body uses insulin, and zinc also seems to decrease body weight in people who are diabetic and are overweight or obese. For oral care, there is some evidence that zinc-containing toothpaste can reduce existing plaque and prevent gingivitis, with or without an antibiotic. And chewing gum, sucking a candy, or using a mouth rinse containing zinc may reduce bad breath. In pregnancy, zinc promotes fetal growth and reduces the risk of premature birth. And even after birth, supplementing infants and toddlers improved brain and physical development in populations who were deficient in zinc. Who's at risk for becoming deficient in zinc, and who needs to take it? Preterm babies with a condition called necrotizing enterocolitis need zinc. Patients with malnutrition or malabsorption from chronic inflammatory bowel disease or gastric bypass surgery. Patients with alcoholic cirrhosis, and those on medications that increase the loss of zinc in the urine, like thiazides and angiotensin receptor blockers. So, does taking a zinc supplement help as a booster? Usually not, unless you are deficient in zinc and need it. Zinc does compete with iron and copper for the absorption pathway, so you could become deficient in iron or copper. This can be used as a treatment if you have a copper overload disorder called Wilson's disease. Can you have a blood test to see if you are deficient? Most blood tests of serum levels are not an accurate reflection of zinc status, particularly if you have an inflammatory condition. The red blood cell measurement is a more accurate reflection of your zinc status. What is the recommended daily allowance of zinc? Adult females and males need about 9 to 11 milligrams of elemental zinc daily, with some increased requirements in pregnancy and lactation. Can you get too much zinc? Our body is quite tolerant, even up to 100 milligrams a day. If you get too much zinc from contaminated food or beverages, you can suffer from diarrhea, nausea, and vomiting. As I always say, too much of a good thing can be a bad thing. I hope you found this information useful. Please do hit the like button and subscribe to my channel for more interesting and useful information coming your way. Take care and be in good health.